Bronchial asthma symptoms. The most characteristic manifestation of the disease is a choking attack. It often occurs after contact with an allergen or under the influence of a provocative factor, when inhaling cold, humid air, tobacco smoke, or during psycho-emotional stress. The seizure develops suddenly. Its symptoms intensify rapidly. The person feels that they are having difficulty exhaling. A pronounced cough appears. Shortness of breath develops, and whistling wheezes may be heard from the side. The patient strives to assume a forced posture, orthopnea, to sit on a chair or bed, lean against it with outstretched arms, bend the body forward. This position is most convenient for the patient, as it somewhat facilitates breathing. If timely medical assistance is not provided, the person's condition worsens. Shortness of breath increases. Coughing intensifies. A feeling of anxiety, worry, fear appears. The face becomes swollen. The skin takes on a cyanotic hue. The symptoms of an attack can disappear spontaneously, but more often, special medications, rapidly acting bronchodilators, are needed to eliminate them. The patient inhales a suspension of the medicinal substance, which penetrates the respiratory tract and quickly causes its expansion. Access of air to all parts of the lungs is restored. Respiration is restored. Also, symptoms of bronchial asthma include frequent coughing at night, a feeling of discomfort, heaviness behind the sternum, especially under the influence of provocative factors, prolonged difficult-to-submit therapy for RV, flow. In the course of this pathology, periods of exacerbation and remission are distinguished. There are also 4 degrees of severity of the disease: intermittent, episodic, persistent, permanent, mild, moderate, and severe. The severity of bronchial asthma is assessed based on the following criteria: the number of night attacks of suffocation per week, the number of strangulation attacks per day and week, the need to use short-acting agonists throughout the day, severity of physical activity and sleep disturbances, changes in external respiratory function, indicators during exacerbation and their absence during remission, daily fluctuations in the peak volumetric exhalation rate. What is bronchial asthma? Bronchial asthma is an allergic disease characterized by recurrent attacks of choking due to bronchial spasm and swelling of their mucous membranes or prolonged coughing. Despite the clear definition of the disease, sufficiently pronounced symptoms, and great possibilities of research methods, bronchial asthma is often diagnosed as a different form of bronchitis and, as a consequence, is ineffectively and inadequately treated with courses of antibiotics and cough suppressants. About illness, bronchial asthma is extremely widespread. Research in recent years shows that between 4% and 10% of the planet's population suffers from this pathology of varying severity. Among children, the percentage reaches 10-15. Moreover, if we believe the statistics, the number of people with this disease has doubled over the past 15 years. In recent decades, the problem of asthma has become one of the most pressing in medicine for a number of reasons: increasing morbidity and worsening of the disease, especially in children and adolescents, early disability, increasing mortality. At the heart of a choking attack or cough, which manifests as bronchial asthma, lies bronchial inflammation, often of an immune nature. If an allergen or the causative agent of an infectious disease enters the bronchi, a complex immune mechanism is triggered. Biologically active substances are released, and special cells are activated. This leads to a disruption of the structure and function of the bronchi, swelling of the mucous membrane, spasm of the smooth muscle, a change in the nature of the bronchial secretion. It becomes thick and viscous. It is difficult to separate and blocks the lumen of the bronchi. Air entering the alveoli of the lungs during inhalation is difficult to drain through the narrowed lumen of the bronchi. In this case, the person breathes out with difficulty. Expiratory dyspnea, a specific sign of asthma, occurs. Surrounding people note whistling sounds produced by the patient. Types of bronchial asthma. Depending on the factors underlying the development of the disease, 2 types of bronchial asthma are distinguished: allergic, non-allergic. The former, in turn, is divided into atopic or IgE-induced and non-atopic, non-IgE-induced. In the course of this pathology, periods of exacerbation and remission are distinguished. There are also 4 degrees of severity of the disease: intermittent, episodic; persistent, permanent; mild, moderate, and severe. The severity of bronchial asthma is assessed based on the following criteria: the number of night attacks of suffocation per week, the number of strangulation attacks per day and week, the need to use short-acting agonists throughout the day, severity of physical activity and sleep disorders, changes in external respiratory function, indicators during exacerbation and their absence during remission, daily fluctuations in the peak volumetric exhalation rate. Causes of bronchial asthma. Bronchial asthma is a multifactorial disease. The following factors influence the likelihood of its development: exposure to household allergens, especially house dust mites, household chemicals, feathers, and pillow fluff. It is the early exposure to dust mites that is the leading provoking factor in the development of asthma in 16 out of 17 children. Working conditions. A number of chemical substances lead to the development of occupational asthma: metals, aldehydes, animal allergens, flour and wood dust, resins, adhesives, latex. There is a high risk of contracting this pathology in livestock breeders, food and chemical industry workers, medical workers, welders, painters, hairdressers, construction workers, and woodworkers. Heredity. As a rule, in the family of a patient with asthma, one of the relatives suffers from this disease or has another pathology of an allergic nature, rhinitis, dermatitis, etc. Climatic conditions, air temperature and humidity, soil characteristics, altitude above sea level, and other factors. In valleys and plains with high groundwater levels, where clay soils predominate, asthma incidence is significantly higher. Low cloud cover, cyclones, and the movement of large air mass fronts increase the number of asthma attacks by more than 2 times compared to calm weather. Seasonality. Some asthmatic patients are sensitive to high and low temperatures, so exacerbations of the pathology occur in them during the winter and summer months. The seasonality of the disease in individual patients may be related to the period of flowering, seed ripening, of certain plant species, ambrosia, alder, birch, etc., excess weight, frequent RV, inhalation of cold and humid air, cigarette smoke, physical load, sharp odors, laughter,